everybody. Yes, yes, yes. It's me, your queen, Angela Johnson, Miss J, you can call me. Welcome, welcome, welcome to my segment on men's health because June is bringing awareness to men's health month. Thank y'all for being in here on this Sunday, relaxing day. Yes, I appreciate that. I appreciate y'all that's going to tap on it, the play button and watch me because you are watching Miss J's Unfiltered Talk Show and Podcast. And as I stated before, I am Angela Johnson, Miss J, your host. All right. So I'm going to go ahead on and get started because it's late. Okay. And I got another one to do. But let me say this real quick. This is my first time in 6 years I have ever pre-recorded anything normal. Then too, I might like this pre-recording thing. Y'all let me know how y'all gonna like it. Do y'all like seeing me live, or do y'all think y'all gonna like the pre-recorded ones? Okay. But anyway, let me go ahead on and get started. So tonight's episode is on prostate cancer. Yes, I am bringing awareness to prostate cancer. We need to do this. And y'all look, I got some mosquitoes in, so y'all might see me doing this every now and then. But just know that I'm hitting at a mosquito, and they probably bite my legs too. Cause I got my thighs and all that out today. But anyway, yes, I'm bringing awareness to prostate cancer. We need to do this, ladies. We need to talk with our partners about this. It is very crucial that our men, especially our black men, get checked. It is. And it is another way men can be checked because it's a reason why a lot of men don't like to be checked. Y'all know, y'all remember back then, but it's not like that anymore. So y'all hold on, I gotta type something here. Okay, there it is. Y'all remember back then when men had to cough. Y'all know what I'm talking about. Okay, ain't gonna say no more. But it's not even like that no more. All right, it's called a PSA test that can get you rolling. Okay, but ladies, please make sure we talk to our kings about this. Okay, it's no joke, and it does save lives. It does. So let me give out my disclaimer as well. I am not no doctor. I am not no nurse. Anything you hear or see on my platform, it is all for educational and informational purposes only. If anybody experiencing anything, please talk to your provider, okay? Talk to them. That's my disclaimer, all right? So when I mention prostate health, what are we talking about? What is prostate health? And it actually refers to the well-being of the prostate gland, and it's about the size. That gland is, the prostate is about the size of a walnut. Okay, and it's located in the male reproductive organ. It is, and it's just below the bladder. Let me repeat that again. It's a small walnut-sized gland and is located in the male reproductive system below the bladder. So let's understand the prostate function. Now they got that prostate, but what is the function of it? What is the function of it, ladies? Of course, y'all know. But what is the function of that male's prostate? It actually produces semen production. The prostate contributes to a fluid to semen, which nourishes and transports sperm during ejaculation. Okay, I'm gonna read that again, and I'm gonna say that again. The understanding the prostate function, it is semen production. The prostate contributes to a fluid to semen, which nourishes and transports sperm during ejaculation. And urinary control. The prostate surrounds the urethra. the tube that carries urine and semen out of the body and helps control urine flow by closing it off during ejaculation. That is understanding the function of a male's prostate. Y'all men already know the function. And those that's watching the replay, share this out. I mean, it might not, you might not need this information, but somebody might need it if you share it, But still, make sure, ladies, you tell your partners to get screened. I'm going to keep saying that because it does save lives. It does. So let's take a look at some common prostate issues. There are common prostate issues. There are. But of course, as men age, it's going to be certain kind of prostate related conditions. And one of them, see, this could have just been, one of them being benign prostatic hyperplasia. Benign prostatic hyperplasia. And the acronym is BPH. But this is a non-cancerous enlargement of the prostate. Most common in men over 50. And it can cause urinary difficulties too, okay? Due to the pressure on the urethra. This is not a non-cancerous one. Benign prostatic. Okay, I'm back. I don't know what happened, but it cut off for some reason. But anyway, I'm back. But again, this one is called, the common prostate health issues is called benign prostatic hyperplasia, BPH, and it's non-cancerous, all right? And the next one is called prostatitis. Prostatitis, and there's inflammation of the prostate gland. That is often caused by bacterial infection, okay? And the next one is the big one, the prostate cancer one. This is the most common form of cancer in men, and especially in the Black African American community. Prostate cancer will affect 1 in 9 over their lifetime. While it grows slowly, but it's treatable if it's caught early. Early detection. If it's caught early. But there are some forms that are aggressive, okay? There are some forms that are aggressive. Y'all sprinkle this out. So let's talk about real quick the symptoms of prostate problems. I want y'all to understand that some of these symptoms can vary depending on the condition, all right? But they're not common. But some are common signs include frequent urination, especially at nighttime, difficulty starting or stopping the urination, weak or interrupted urine streams, painful or burning urination, blood in the urine or your semen, okay? Blood in your urine or your semen, or painful ejaculation, okay? Those are the symptoms. So how can we keep maintaining, how can our man keep maintaining their prostate health? Well, there are still some risk factors for prostate problems that are beyond control, okay? Such as your age and genetics. That varies, all right? But there are certain lifestyle choices may help support prostate health. Healthy diet, regular exercise, maintain a healthy weight, okay? Stop smoking. Eat healthy, eat a lot of vegetables and fruits and vegetables, grains and fish, healthy fats. But while limiting that red and processed food, okay? Do exercises. Maintain your healthy weight, all right? Obesity has been linked to a higher risk of more aggressive prostate cancer, being overweight, okay? And as I stated when I got started, ladies, please make sure your partner get regular screenings. And men, please discuss this prostate cancer screening with your doctor, especially if you are over 50 and it runs in your family. If your dad had it, your uncle had it, yes, please get checked. They don't have you to cough anymore, okay? They don't have you to cough anymore. They don't. So now that happens, you know we got treatment for it as well. So yes, prostate treatment varies depending on the specific condition. All right. So an enlarged prostate or prostate cancer, it depends on its severity. All right. For an enlarged prostate, that's that BPH one. Treatment options include, of course, you got to do lifestyle changes. Do your lifestyle changes, medication, and there are invasive procedures, or you might have to have surgery. It's okay, but it's saving your life. Okay. But for prostate cancer, treatment options include actives. They got to keep watching it. They're going to keep watching it, constantly watching it. Surgery and radiation therapy, hormone therapy, and there may be other therapies as well. Okay? But the thing of this is, ladies and gentlemen, we have to make sure our partners, our boo-boos, our husband, our boyfriends get checked. Please get checked because it does save lives. And I know as a man, because I've had one of my sons tell me, I ain't trying to go up there and have to cough. And I had to let him know they don't do that. They don't do that anymore. When you go get your blood work, men and ladies, when you let your man know, tell them doctor to run a PSA test on your man if they're over 40, and regardless whether it's running their family or not. Ask your doctor to do a PSA test. That'll start the ball rolling. Yay or nay. Them numbers be too high. That'll start the ball and rolling. That don't mean too much anything, but it still make them go in and make them dig in a little bit further, okay? Just make sure you get checked. It does save lives. I know this for a fact. It saves lives. Okay? Make sure y'all do that. Now, I told y'all I wasn't gonna hold y'all long. So I wasn't gonna hold you long. But again, the bottom line this is in summary. Prostate health is about recognizing the importance of the prostate gland and taking steps to maintain its well-being through lifestyle choices and regular medical checkups. That's what's important. If you experience any concerning symptoms, it is crucial to consult with a healthcare professional for diagnosis and appropriate treatment. That's the bottom line on this. I told y'all I'm going to hold y'all long. I told y'all that. I'm going to hold you long. But the bottom line, get checked. It does save lives. It saves lives. Now, with that being said, I'm getting ready to close this segment out. Men, get checked. Ladies, talk to your man. Talk to your son if they older enough to get it checked. Let them know things have changed. You ain't got to cough anymore, okay? Because it does save lives. Thank y'all for being in here. It's a Sunday. Thank you for clicking on, even watch, taking the time to watch. Y'all know I appreciate that, and I love y'all. I will see y'all in a few minutes on my next one called PTSD. We got to bring awareness to that. All right? Look, y'all have a good one. I love y'all.